Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And, we've had so many, I guess you'd say, comments back to us relative to a show that we did about a year ago about neurology. But really we focused a great deal upon the issues related to neurologic surgical techniques. And I was really amazed at the number of questions and comments, because the show belongs to the people who are viewing. I just sit here and try to give them information through you. And I just thought it would be a good time to bring someone back. And the minute I heard of the new Marcus Neuroscience Institute up at Boca Regional Hospital, I said to myself, well, let's see who we can get. And here we are. So in front of me is Dr. Frank Vrionis, Ph.D., M.Ph., but most importantly, he is a highly skilled, trained medical physician. Welcome, Dr. Vrionis.
Thank you, sir.
Thank you for being here. And he's a neurosurgeon, we'll get to that. And then we got Patricio Espinosa. Dr. Espinosa is also a medical doctor, and he also has a master's in public health, which is, to me, it's very impressive when physicians take themselves beyond to see how their knowledge affects the entire spectrum of people. And you're the chief of neurology at, Boca Regional, and you also are affiliated with the Marcus Neuroscience Institute. Dr. Vrionis, tell us about the Institute.
Well, this is a 57,000 square feet institute. It was built about 2 years ago by Mr. Bernie Marcus. As you know, he was the founder and CEO of Home Depot chain, a great philanthropist, and we've really benefited from his contribution. The Institute is really the only neuroscience institute in the Southeast Florida, and houses a group of neurologists, about 10 now neurologists, 4 neurosurgeons, other health professionals. We have 4 dedicated operating rooms, 20 step-down and ICU, neuro-ICU beds with nurses that specialize in neuroscience type of problems. And so it's a neuroscience comprehensive institute, everything under one roof, dealing with patients who have neurological or neurosurgical disorders.
Dr. Espinosa, there's been so much brought to us, and again, it goes beyond just the surgical interventions, because we get a lot of questions and comments from our viewers relative to what turns out to be a neurologic issue. Everything from severe headaches to inability to be mobile to incontinence to a lot of different things that turn out to be neurologically involved. So let's try to give the folks an idea of what a neurologist in your position sees, and then we'll talk about the collaborative nature between you and Dr. Vrionis.
Perfect. Yeah. Thank you for having me again. A neurologist is a clinician that is specialized in disorders of the brain, the spinal cord, the nerve, and the muscle. So there are various symptoms that all these organs can have. For instance, as you well said, headache. Another big group of things that we do is take care of stroke patients, patients with epilepsies, patients with multiple sclerosis, patients with movement disorders. So there are various signs and symptoms that we treat in neurology. That's as a broad term. But then we have like 5 or 6 specialties within neurology. So neurology as a field has evolved so much that we have a specialist in headaches, a specialist in strokes, a specialist in epilepsy, a specialist in movement disorders like Parkinson's disease, essential tremor, and neuroimmunological diseases such as multiple sclerosis. So neurology has become so specialized that now we have a specialist in each of the fields that can help patients. For instance, we have a specialist in dementia, in memory disorders, and things like that. So that's how neurology has evolved, and we treat various symptoms that involve the nervous system.
Recently, and I give you just something that came my way. One of our faculty individuals here was having problems relative to what this person thought was a GI problem, a gastrointestinal problem. It turned out that it really was the imposition on the compression of a certain nerve unit. I think it was a thoracic unit, if I'm not mistaken. I'm not playing doctor, I'm just trying to remember the conversation. And it was very clear that the individual was having these problems not based upon the GI tract itself. It was the system, the neurologic system, the control mechanism that caused all this problem.
You know, and actually it touches both of us. What likely your friend had was probably something compressing the spinal cord at the T level, at the thoracic spine. So that can cause problems with the control of the bladder, the bowel, or it can give you radicular pain, which means that the pain comes because of the nerve roots are compromised. So likely that's what happened to your friend and colleague, is that he had probably something pressing or pushing into the nerve roots or the spinal cord. And that's when we get the help of neurosurgery to try to fix that problem with surgery.
So now we turn to Dr. Vrionis, who is your colleague.
Yeah.
You as the neurologist you by somehow, and this I give great credit to this gastroenterologist who said, I think you need to be referred to a neurologist. So that person now comes to you, and now you hand that person over to Dr. Vrionis.
Yeah, this is a very common actually scenario. We see patients are not always fall into the black and white type of scenarios. Like when you take your board exams, patients have one very simple diagnosis and you have to find it. But in real life, patients have multiple problems. They may have something like a stomach ulcer or what have you, and something like a thoracic disc herniation that can cause this pain that goes around and wraps around the abdomen. So these are common scenarios where you have to individualize the treatment, you have to put everything into account, you have to collaborate with your neurologists and other specialties. There's a lot of patients who are unfortunately misdiagnosed, patients who are called to have dementia and they have spinal fluid accumulating in the brain, or patients who are treated for multiple sclerosis and they have something treatable like spinal stenosis there, or patients who have a vascular malformation that causes seizures or what have you. There's a lot of things that they don't fall exactly as to where the textbook says, and that's why it's an art and not a science always, and that's why I think computers are not going to replace medical doctors anytime soon because of the cases like you mentioned.
There's so many issues that relate to both of you as neurologists and as neurosurgeon that are integral to what I would call our population in Florida, particularly South Florida. We have the highest percentage of people over the age of 70. We have the highest percentage of people in the United States over the age of 85, not by number than the people over the age of 85. And you say to yourself, these are the people who have beat all the odds, in essence. Whether it's genetic, whether it's good care, whether it's good medical care, whatever it is, it's a fact. Here we are. And all they want, most of our viewers who communicate with us, all they want is a process in which they can appreciate their life. In other words, they want to have just, a normal life. They want to go out of the house, they want to drive their cars, they want to walk in the mall, they want to visit their grandkids, and there is this imposition of these neurologic issues that impede them. And that's why I wanted to speak to you today. There is something that I want to talk to before we go much further, is that knowing of the Marcus Neuroscience Institute and the abilities that you have because of the newest and most valuable technique equipment. In other words, they can give you all the equipment you want. Without your hands and your brain and your heart, both of you, none of this works. So what I'm wondering is, you probably deal with everything from what most people want to know about the brain tumors, and they want to know about spinal stenosis and all the spinal issues. That's the most disquieting comments that come from our viewers. But tell me now, since you were trained, the changes are so dramatic in neurologic intervention. So why don't we talk about that for a while? Either one of you, start.
Okay, well, I think, in neurology, we have shifted from a field that we used to diagnose things very, very, very well to a field that now we can actually do things. And one of the things that I'm very passionate and I like a lot is stroke. So up until recently, only 2 years ago, we were able to show that clot retrieval from the brain can change patients' life. So as a medical student, I remember this patient that came in. The patient had atrial fibrillation, which is an irregular heart rhythm. The patient was hemiplegic, that means that half of the body was not working. And the only thing that we did for this patient at that time was basically blood pressure control, heart rate control, and that was it. So now, if we see a patient within a certain time frame, if somebody has a stroke or a stroke-like symptom, which is weakness in one side of the body, we like to see them right away, because within 4.5 hours, we can give a medication that can release the clot and can restore function. But sometimes those clots are quite big. And now with the help of new intervention, we can go through the groin, go up through the vessels and pull that clot out. And patients from hemiplegia can go back to have a normal life. A stroke is the major cause of disability here in the US. With these life-saving procedures, we change patients' life. So going back, I graduated in med school in the year 2000. To today, there has been a major change in the stroke care. We can definitely change patients' outcomes. In the past, we couldn't do anything. I know exactly what happens if we don't do anything. Patients will be hemiplegic, they will be disabled. Now with these interventions, we can change people's life, and we do this in our center, where we have, we're a comprehensive stroke center. We have 24/7 stroke care. We also have telemedicine, where we can assist patients for stroke care within 5 to 10 minutes. In neurology and in stroke particularly, time is brain. The faster we see the patient, the faster we can treat them. And to send a message to our viewers, if somebody has stroke-like symptoms, you have to call 911, because in our area, there are stroke systems in place where as soon as the EMS identifies a stroke, there's a signal sent to the ER, and the stroke team is waiting for them to assist them promptly. And the stroke team is composed of the nurse, the ER physician, the neurologist, the neurointerventionist, the neurosurgeon. A group of doctors are devoted for the stroke care. So that has been one of the things that have changed tremendously in the last few years.
I'm glad you brought that up, because we had a wonderful program about a half a year ago. I had EMT paramedics sitting here, all right? And we were talking about they had such pride in the fact that they had these communicative opportunities with the certified comprehensive stroke centers. Don't forget, every hospital is not a certified comprehensive stroke center. And that they were able to save the lives of these individuals. They were talking about the golden hour, which of course, the quicker they get them to the hospital, the quicker they can react to the neurologic interventions. Dr. Vrionis, here you are. There's a surgical, or I guess you could say, it's a surgical intervention. So now the patient is handed over to Dr. Vrionis, or is that it?
If the patient needs surgery, we're part of a team, and as you said, it's a collaborative effort that involves the hospital, the nurses, the EMTs. We would like to educate them. In many cases, we're interested in putting a mobile ambulance unit in the Palm Beach area through help from Mr. Marcus, so that we can start the TPA and the anticoagulants right at the site of the scene. And we're probably a couple of years out before we implement something like this. But we're really pushing the envelope in almost every front. From the stroke, stroke is a great example because it used to be like a very nihilistic, fatalistic type of attitude 20 years ago. It's like you have a stroke, there's nothing you can do about. To now, seeing a patient with a stroke one day unable to talk and the next day walking and going home and playing golf. And we've seen patients who are 97 or even 100 now being treated aggressively and have very meaningful quality of life. So medicine can do now things that we could never imagine even before. And the same thing applies for a lot of other degenerative problems that affect the spine, because that's another very common area. We see a lot of patients who are like in their 80s or 90s with spinal stenosis, and in the older days we used to say, well, there's not too much you can do other than take medications, what have you. Now we can do very targeted, accurate laser type surgeries with a very small incision, about less than an inch, without cutting any muscle, by putting a tube down to the spine. So imagine looking at the spine through a little keyhole, and then freeing up the nerves without doing any kind of major surgery. And you have patients who are even 97 or 100 going home the next day, because these are very small targeted surgeries with minimal type of risks. And the old notion, because somebody is old and because of that we don't treat them, doesn't apply to today's day, in my opinion. As you said, for somebody to reach that age, it means either the biology, the genetics, the lifestyle is strong enough that this patient does deserve to have a chance to live a quality life from there on.
That's the number one statement that comes from our viewers, is that they're not looking for miracles, they're looking for quality of life.
Yes.
So you just hit on it.
So to me, to summarize, it is not really a minimally invasive surgery. It's a minimally invasive philosophy of surgery. In other words, it's not the techniques as much. It's really the philosophy of the surgeon. People are attracted to the lasers. Well, the lasers don't have any meaning in the spine anyway. It's just a marketing tool, as you know. But what is important, and that's very important for the audience to understand, is the minimally invasive philosophy. In other words, instead of doing an incision that big and have somebody in the hospital for 10 days, if you can do it with something like that big and have the patient go home the next day, that's really the philosophy. Do small, go small instead of go big, and try to have the patient recover fast and promote a healthy living. So that's really the most important thing, because now we have the techniques to do that. We have minimally invasive screws, percutaneous instrumentations. We can burn tumors through needle sticks. We can restore vertebral bodies through kyphoplasties and cement. We can do things with very little interventions, to the point that somebody can go home the same day. 15 years ago, we couldn't do that. We had to do some huge open surgery, very life-threatening, for something that today we put a little cement there and the patient goes home the same day. So there's a lot of technology that we have to use together with good, solid judgment. And it's the solid judgment that precedes the technology, because, as you know, a fool with a tool is still a fool. So it's very important to marry those two principles.
That's a wonderful statement. That's really a wonderful statement. Let me ask you, because we do have specific questions. You hear about often brain tumors, meningiomas, brain tumors. I know that there's been a lot of, I guess I should say a lot, but a good deal of discussion about, particularly in children, the use of a proton beam and things of that nature. I don't want to get into whether one is good and one is not good, but I know that the new techniques, again, apply to these types of masses. Can we talk a bit about that?
Sure. I mean, these are, again, tools. radiation really tools. And there's a lot of them. You've heard like from cyber knives to proton beams to all kind of novalis, gamma knives, what have you. All of these, the principle is the same, is targeted radiation using different forms of energy. Some of them using protons, some of them electrons, some of them photons, different ways to deliver energy selectively into a tumor mass and destroy it. Most of them are extremely accurate, and superiority is very hard to really prove. The proton beam really has an advantage when tumors are very radio resistant, and there are some very selective entities like chordomas, chondrosarcomas, things like that, that they're not very sensitive to conventional radiation. In those cases, the proton beam machine may be a better tool. But for the common type of problems, the common type of tumors, it may not have any difference than conventional machines that every place has.
Dr. Espinosa?
Yes, so in terms of brain tumors, we at the center, we have a neuro-oncologist which specializes just in brain tumors. He's running multiple clinical trials in novel treatments for brain tumors. So in our center, we have the capability not only to diagnose somebody with a brain tumor, but we also have the capability of using novel treatments for this disease. In our center also, we have MRI, which is very particular. Is a 3T. It has a lot of definition, and also one of the nice things is that with our surgeons, with Dr. Vrionis, we can do intraoperative MRI. So when they are resecting the tumor, we can see the depth, the extent of the tumor, while the surgeon is doing surgery. So it's quite fascinating and interesting what we can do in brain tumors these days, trying to minimize the area that we take out in order to preserve the brain. So one of the things whenever we do surgeries or we perform surgeries is that we're worried about the outcome of the patient if there's going to be any deficits. So what we do as well too in our center is we can do what is called language mapping, or also localization of eloquent areas, which means areas that are vulnerable to injury. So with the help of an EEG inside of the brain, they're called subdural electrodes, we can assess what areas of the brain are prone to injury and to avoid those areas. So that's the collaboration that we do, and these novel things that we can do to treat our patients with brain tumors.
You're talking about using this advanced MRI. Certainly you're not going to be dealing with it. You're going to have some interventional radiologist or otherwise being involved. Is that correct?
Actually, all you need is the CT or the MRI tech. The patient is in the OR, let's say sitting right there, and they press the button, and the machine, there's like a part of the wall opens up, and the machine comes to the patient comes to the machine. So they kind of like start moving together, they get the study, and then they go back. So really, it's a very cool thing to watch. And in fact, actually, we have some clinical trials now for malignant brain tumors where we can see the drug going in real time. We actually mix it with some contrast, gadolinium, and we can see how it infuses in real time in the OR in the brain tumor area. So we can modify the injection during the time of the surgery. So we're participating in over 10 clinical trials now on malignant brain tumors. Actually, we have the largest number of clinical trials in the state. And we do have very unique trials that nobody else has. And that's really for patients with malignant brain tumors.
I want to just sort of cap the show off because the people were very interested dominantly in minimally invasive. They're very big, and they don't like surgery. I mean, I shouldn't say that, but that's what I hear all the time. I'm worried about cutting, the blood and the pain and whatever. And minimally invasive techniques are very interesting to our viewers. So you've touched on that, but I want to sort of cap this off with both of you communicating to the people who are listening about the Neuroscience Institute, the Marcus Neuroscience Institute, and the extraordinary opportunity they have by using your talent. Dr.
Well, thank you again for having us today. The Marcus Neuroscience Institute is a leader in neuroscience care in South Florida. We have a specialist on every field in dementia, memory disorder, stroke, epilepsy, neuroimmunology, MS, headache. So in our center, we have been able to group a fantastic group of neurologists in each specialty to attend to each problem that a patient can have due to a neurological condition. With the help of neurosurgery, we're able to do state-of-the-art procedures that were not feasible before in the area. Also with the stroke care, with the neurointervention, we're doing these procedures that are unique and can change patients' life. So I will invite them to come and visit us and check out our institute. It's a wonderful place, wonderful doctors. We have a very collegial environment. We have an academic affiliation with FAU. We're going to start a residency program in the year 2018. And so great things are happening. We are trying to elevate the care in neuroscience in our area.
We would love to have, by the way, a collaboration with Nova Southeastern University. We're very impressed by your campus and by your medical facilities here as well.
The intent was to make them feel better because of some of the things that both of you said, but particularly in the surgical area.
In the surgical areas, I mean, it's the principles, I mean, that we're trying to convey to the audience. And the principle is it doesn't matter how complicated the problem is, we can tackle it, we can handle it, we can help patients. The second thing is we emphasize minimal invasiveness, quality of life, and outcomes and patient satisfaction. When I first came, I was told that our biggest competitor was the Fort Lauderdale Airport. Right now, we start seeing patients coming back now from New York. If they had a serious problem, they would just leave, go to New York or something. Now they're coming back from New York after they have left because they have a medical issue or they're sending their friends. So we're changing the way that the medical field is working in the Palm Beach County, and I think there is more to come.
I'm asking you to take good care of yourself. And remember, this program is your program. If you have any questions, you have any comments, just dial us up or give us a little note on the internet. And remember, this show comes to you from Nova Southeastern University. My name is Fred Lippman, and until next time, see you.